Individuals can reduce the risk of HIV infection by limiting exposure to risk factors. Correct and consistent use of male and female condoms during vaginal or anal penetration can protect against the spread of sexually transmitted infections, including HIV. Evidence shows that male latex condoms have an 85% or greater protective effect against HIV and other sexually transmitted infections. Testing and counseling for HIV and STIs are also very important. It is strongly advised for all people exposed to any of the risk factors. In this way, people learn of their own infection status and access necessary prevention and treatment services without delay. The World Health Organization also recommends offering testing for partners or couples. Additionally, the World Health Organization is recommending assisted partner notification approaches so that people with HIV receive support to inform their partners either on their own or with the help of a healthcare provider. TB, or tuberculosis, is the most common presenting illness and cause of death among people with HIV. It is fatal if undetected or untreated and is the leading cause of death among people with HIV, responsible for 1 of 3 HIV-associated deaths. Early detection of TB and prompt linkage to TB treatment and ART can prevent these deaths. TB screening should be offered routinely at HIV care services, and routine HIV testing should be offered to all patients with presumptive and diagnosed tuberculosis. Individuals who are diagnosed with HIV and active TB should urgently start effective TB treatment, including for multi-drug resistant TB and ART. TB preventative therapy should be offered to all people with HIV who do not have active TB. Voluntary medical male circumcision, known as VMMC. Medical male circumcision reduces the risk of heterosexually acquired HIV infection in men by approximately 60%. This is a key prevention intervention supported in 15 countries, including Eastern and Southern Africa, with high HIV prevalence and low male circumcision rates. It is also regarded as a good approach to reach men and adolescent boys who do not often seek healthcare services on their own. Antiretroviral drug use for prevention. The risk of transmitting the virus to their uninfected sexual partner can be reduced by 96%. World Health Organization recommendations to initiate ART in all people living with HIV will contribute significantly to reducing HIV transmission. Pre-exposure prophylaxis, or PrEP, for HIV-negative partners. Oral PrEP of HIV is the daily use of ARV drugs by HIV-negative people to block the acquisition of HIV. World Health Organization recommends PrEP as a prevention choice for people at substantial risk of HIV infection as part of a combination of prevention approaches. The World Health Organization has also expanded these recommendations to HIV-negative women who are pregnant or breastfeeding. Post-exposure prophylaxis for HIV, otherwise known as PEP or PEP, is the use of ARV drugs within 72 hours of exposure to HIV in order to prevent infection. PEP includes counseling, first aid care, HIV testing, and the administration of a 28-day course of antiretroviral drugs with follow-up care. The World Health Organization recommends PEP use for both occupational and non-occupational exposures, and for adults and children. Harm reduction for people who inject and use drugs. People who inject drugs can take precautions against becoming infected with HIV by using sterile injecting equipment, including needles and syringes, for each injection and not sharing drug using equipment and drug solutions. Treatment of dependence, and in particular opioid substitution therapy for people dependent on opioids, also helps reduce the risk of HIV transmission and supports adherence to HIV treatment. A comprehensive package of interventions for HIV prevention and treatment includes needle and syringe programs, opioid substitution therapy for people dependent on opioids and other evidence-based drug dependence treatment, HIV testing and counseling, HIV treatment and care, risk reduction information, education, and provision of naloxone, access to condoms, and management of STIs, tuberculosis, and viral hepatitis. Elimination of mother-to-child transmission of HIV. The transmission of HIV from an HIV-positive mother to her child during pregnancy, labor, delivery, or breastfeeding is called vertical or mother-to-child transmission, known as MTCT. In the absence of any interventions during these stages, rates of HIV transmission from mother to child can be between 15 and 45%. MTCT can be nearly fully prevented if both the mother and the baby are provided with ARV drugs as early as possible in pregnancy and during the period of breastfeeding. So what is the treatment plan for HIV and AIDS? HIV treatment involves taking medicines that slow the progression of the virus in your body. HIV is a type of virus called a retrovirus, and the drugs used to treat it are also called antiretrovirals. These drugs are always given in combination with other ARVs. This combination therapy is called antiretroviral therapy, or ART. Although a cure for HIV does not yet exist, ART can keep you healthy for many years and greatly reduce your chance of transmitting HIV to your partners if taken consistently and correctly. Antiretroviral therapy, known as ART, reduces the amount of virus or viral load in your blood and body fluids. It is recommended for all people living with HIV, regardless of how long they've had the virus or how healthy they are. HIV treatment is most likely to be successful when you know what to expect and are committed to taking your medicines exactly as prescribed. Working with your healthcare provider to develop a treatment plan will help you learn more about HIV, manage it effectively, and make decisions that help you live a longer, healthier life.